So without further ado, I'd like to welcome our guest of honor for the evening, Dr. Alka Kanaya from UCSF.
Thank you so much. So what type of diet do participants eat? Three major dietary patterns in our Masala study participants. Mostly an animal protein or Western diet here depicted on the left with more meat. Third, we're eating fried snacks, sweets, and high-fat dairy. So that's kind of depicted here in the middle. You can see a lot of fried snacks and sweets that are typical of South Asian diets. And then a third, we're eating mostly fruits, vegetables, nuts, and legumes, kind of this healthy, more prudent diet. So what about psychological factors? How are they associated with atherosclerosis? So we measured many different psychological factors like anger, anxiety, depression, stress, chronic stress, everyday hassles. 70% of the South Asians in our study described their adult children as being role models for them, that the health behaviors that their adult children have for diet and exercise are really influencing their own behavior. We wanted to look at hidden fat stores in the body of our participants, and we were able to measure fat in muscles, fat in the liver, fat around the visceral organs. So this is all of the intestines and other abdominal organs, fat around the heart. And what happens in the process of having a heart attack is this calcium plaque can become vulnerable. It can rupture. And if it ruptures, all of this, the lipids, the molecules that are contained in the plaque can come out of the plaque that has been sealed with a cap. And that can cause platelets, blood products, blood cells to get stuck and to cause a clot to happen in the artery, which disrupts the blood flow. And that is the process of developing a heart attack. A few people ask about how we can reduce CAC and can we go backwards in CAC. CAC is something that is very hard to show regression of. Most of the time, once you have the plaque established with the calcium, there's not a whole lot of going backwards. What we want to see is a slower rise in the CAC amount. And that can be what you do with your lifestyle changes, with improving your diet, improving exercise, improving your stress reduction. Those things can matter.
Thank you to Dr. Kanaya and our panel, and thank you to our audience.